Welcome back to our professional nursing series. In today's session, we'll explore a vital topic in aged care: nutrition and hydration in older adults. Good nutrition and adequate hydration are the foundations of health, yet malnutrition and dehydration are common challenges in residential aged care. As nurses, it's our role to identify risks, provide safe feeding assistance, and tailor diets to meet each resident's needs. This is a presentation of data from healthcare. Learning objectives. By the end of this video, you will be able to 1. Recognize the signs of malnutrition and dehydration. 2. Describe types of diets and fluid requirements for older adults. 3. Provide safe and respectful feeding assistance according to each resident's level of need. Apply a resident-centered approach to nutrition and hydration in aged care. Oz. Section 1. Why nutrition and hydration matter. Older adults often have reduced appetite, difficulty swallowing, or medical conditions that affect their nutritional status. Without proper intake, residents face increased risk of falls due to weakness, delayed wound healing, infections from reduced immunity, confusion and delirium, and hospital admissions. Hydration is equally important. Even mild dehydration can cause dizziness, urinary tract infections, constipation, and cognitive decline. Recognizing these risks early is essential. Okay. Section 2. Recognizing malnutrition. Signs of malnutrition in older adults may include unintentional weight loss, muscle wasting or frailty, clothes or dentures becoming loose, poor wound healing, fatigue or low mood. Screening tools like the Malnutrition Universal Screening Tool or tracking BMI and weight changes help identify residents at risk. Section 3. Recognizing dehydration. Older adults may not feel thirsty even when dehydrated. Watch for signs such as dry mouth or lips, dark urine or low urine output, constipation, dizziness, confusion, or delirium, poor skin turgor. Residents with dementia or mobility issues are especially vulnerable as they may forget or struggle to access fluids. Section 4. Types of diets for older adults. Nutrition must be tailored to each individual's needs. In aged care, you may encounter regular diet, normal texture foods, a soft diet, soups, stews, mashed vegetables, and soft fruits, a pureed diet, smooth consistency for those with swallowing difficulties, high protein, high energy diet, extra calories and protein for wound healing or weight loss, diabetic diet, controlled carbohydrate portions, foods respecting religious and cultural needs. Always check care plans and dietitian recommendations before serving meals. Chapter 5. Fluid requirements. Most older adults require around 1.5 to 2 liters of fluids per day, unless medically restricted due to heart or kidney conditions. Fluids don't always mean plain water. Options include water, milk, and juice, tea, coffee, or herbal drinks, soups, broths, and smoothies. Fluid-rich foods like jelly, custard, and melons. Use intake and output charts for residents at risk and encourage regular sipping throughout the day. Undull. Chapter 6. Feeding Assistance. Best Practices. Not every resident eats independently. Feeding assistance must always be respectful and safe. Levels of assistance include Levels of assistance include supervision only. Resident eats alone but needs monitoring for safety. Partial assistance. Staff cut food, provide reminders, or offer prompts. Full assistance. Staff feed the resident, ensuring dignity and comfort. Key principles. Sit the resident upright at 75 to 90 degrees. Explain what food or drink you're offering. Offer small portions at a slow pace. Watch for coughing, choking, or food pocketing, possible signs of aspiration. Use adaptive utensils or cups to promote independence. Always remember, mealtime is not just about nutrition. It's also about dignity and social connection. Chapter 7. Resident-Centered Approach. A truly resident-centered approach respects individual choices. Encourage residents to express preferences, involve dietitians for specialized needs, and offer culturally familiar foods. Document intake. Report concerns about poor appetite or swallowing difficulties, and escalate to the GP, dietitian, or speech pathologist when needed. Chapter Reflection. Think about your last mealtime shift. Did you notice any resident at risk of malnutrition or dehydration? How could you encourage fluid intake in a way that feels natural? Did you slow down to make feeding assistance a dignified social moment? Reflection helps turn everyday practice into safe, compassionate care. If you found this video helpful, don't forget to subscribe to the channel for more professional nursing content, including aged care skills, clinical training,